Hello, I'm Dr. Deepika from Sarita Dental Clinics, and today I'm going to talk on wisdom teeth. So, what are wisdom teeth? Wisdom teeth are the last set of molar teeth that are present at the backmost of your teeth, and they usually erupt around 17 to 21 years of age, and hence the name wisdom teeth. So, what are the issues with wisdom teeth? There are a number of issues with wisdom teeth, and the most common one is impaction. Impaction refers to a situation where the wisdom tooth is partially erupted or is not in a proper alignment. As you all know, wisdom teeth are the last ones to erupt in the mouth. They do not usually have the space, good enough space for them to erupt in a proper position, which leads to improper positioning of the tooth within the arch. While some of the impacted teeth cause no harm, a majority of them cause hassles like food debris accumulation, infection, plaque buildup, etc. So when do we have to remove the wisdom teeth? Usually if you're somebody with a wisdom tooth which is impacted but you have no symptoms such as pain or infection, it is perfectly fine to leave it there with no extraction. However, if your wisdom tooth shows symptoms such as infection, pain, you will have to go for a extraction. In few situations, the extraction can be avoided, but there are certain situations where it cannot be avoided at all. Severe decay, gum infection around the tooth, that is pericoronitis, abscess, cyst, any sort of growth around the tooth are few of the situations in which you might have to undergo an extraction. The wisdom tooth removal is usually done by a specialist like oral maxillofacial surgeon and requires local anesthesia. However, the process of extraction is more elaborate compared to the normal extraction process. This procedure depends on a number of parameters such as angulation of the tooth, the soft tissue covering the tooth, the amount of bone that is present, and the vital anatomical structures that are present. Well, if you're somebody who has to undergo a wisdom tooth removal, the complications that you can expect are very minor, such as swelling, tenderness, a slight numbness feeling in your lower lip and chin, a tingling sensation. Another complication that might result is something called a dry socket, which results in a dull aching pain. But however, the patients usually recover within 7 to 10 days, so there is no issue at all. So a few precautions that you will have to take after the extraction of wisdom teeth are not taking any hot liquids, avoiding hot tea, coffee or any hot soup or any sort of hot food, making sure that you're keeping the area of extraction clean by preventing any sort of food debris accumulation, avoiding alcohol, and also do not get into too much of physical activity or exercise. So if you're somebody dealing with a wisdom tooth and if you're in pain, for sure medicines will help and heal it for a temporary phase of time, but remember it is not a permanent solution. You'll definitely have to undergo extraction at some point of time for which a dentist is the right person to judge and tell you whether you need an extraction or not. So be wise and get your wisdom teeth checked today. Thank you.